Health Improvement Plan update. Thank you for joining us today. We're very pleased to have you with us. I would ask that you please mute yourselves during the presentation, and if you go to speaker view, you'll see whoever is talking at the moment. So this has been, it goes without saying, an incredibly challenging year, one that has tested all of us in ways we never imagined. We subtitled this presentation, "What About Community Health in a Pandemic?" Yet we've accomplished some pretty remarkable things in the face of the challenges. Before we get started with our updates today, I'd like to welcome Mark Bone, the chair of the Midland County Board of Commissioners, and Maureen Donker, mayor for the city of Midland, to provide their welcome. Thank you both. Mark?
Good morning, everybody. Hope everybody's having a great day. I'm chairperson of the Midland County Board of Commissioners, and I'd like to thank you all for attending the 2021 and our first virtual Community Health Improvement Plan update. It's a collaborative effort of many community leaders and organizations. 2020 taught us many things, especially how important both our physical and mental health is. The mission of the Midland County Board of Commissioners includes protecting the health, welfare, and safety of the residents of our community and our employees. Government cannot do this alone, and I appreciate the commitment of the many entities from CHIP that have helped us with this process. At this time, I'd like to turn it over to our city mayor, Maureen Donker. Maureen, please feel free to take it away.
Okay. Hey, thanks, Mark. Well, good morning. It's really nice to be here with all of you this morning. I'm sure that you have heard me say this before. Midland wants to be a community of choice, and when we say that, this is what we mean. We want to be a place where businesses want to locate and people want to live. And there isn't just one thing you can do to make that happen. You have to do lots of different things to make that happen. Now, I'm always amazed because so many people think government does it all. Well, let me just say, I can assure you that we do not do it all. Really, I think how a community of choice happens is through collaborations. And this is one of the most wonderful collaborations I think that we have in our community. And I think the work being done by the Health and Human Service Council and the Community Health Improvement Plan Group is really incredible and truly makes a big difference here in Midland. So when I think about 2020, I mean, it was a pretty interesting year. And I think the word that gets used most of the time, it was unprecedented. So when you think about a pandemic and then 2 dams breaking, there was a lot that we needed to overcome. And in spite of that, the Community Health Improvement Plan continued, and folks continued to work on improving community health. And that is so important here in Midland. And it is one of the things that I think makes Midland a wonderful place to live. So I'm excited to be here today. As I'm sure all of you are, to hear about the work that's going on. And I want to say thank you on behalf of the community to everyone who is working so hard to make Midland the great county that it is.
Thank you both, Mark and Maureen. Appreciate your welcomes this morning. And good morning again. My name is Sharon Mortensen. I serve as chair of the committee that oversees our Community Health Improvement Plan and as a member of our Health and Human Services Council. In my day job, I serve as president CEO at Midland Area Community Foundation. So the Community Health Improvement Plan began in 2016, so 5 years ago. And why did we develop? Well, we saw some needs in our community and we wanted to proactively address those needs because, as we know, Midland's motto is "Together, Forward, Bold," an exceptional place where everyone thrives. And we saw several things happening in our community. One is we had an aging population. We wanted to be sure we could properly serve them. We had concern over substance abuse in our community. Following the nationwide challenge in 2017, the highest number of people on record died of a drug overdose nationally. In 2016, nearly 800 Midland County youth reported thoughts of suicide or suicide attempts. And there's a decrease that was happening at that time in life expectancy across the United States due to suicide and drug overdose. And 33% of Midland County adults were obese, which was higher at that time than the Michigan average of 31%. So those were factors that prompted us to say, let's put a plan together to really address some of these key issues in our community. Now, this plan came out of the Health and Human Services Council. And as our mayor already mentioned, that's a collaborative group that helps to promote our community's welfare and connects us with one another. And it's based on a collective impact model. And that means to solve tough social issues, it takes many of us working across our organizations. And the Health and Human Services Council meets monthly to do just that, to work on some of the tough issues in our community, to come up with innovative solutions and to move us forward. The guiding principles on this next slide of the Health and Human Services Council is that families have complex needs that cut across agency boundaries, that collaborative services produce the best results, and honestly, local people solve local problems. So those are things that prompt the way that we do our work as a Health and Human Services Council and as we work on the Community Health Improvement Plan. On the next slide, you'll see our council membership, and we have 27 key community leaders focusing on health and social service delivery. And you'll see all of our smiling faces in a different time and a different time of year as well. And we work to foster collaboration and cooperation. We have social service agencies, education, healthcare, business, the faith-based community, the courts, law enforcement, city and county government, all represented in this group that meets on a monthly basis. And the 4 priority areas that I mentioned earlier are healthy weight, later life quality, substance use disorder, and mental health. And I will mention when we initially began our community health improvement plan in 2016, we focused on the first 3, healthy weight, later life quality, and substance use disorder. And then we added mental health in 2017, knowing what a critical area that was for our community to address in a collaborative way. So today we're excited to share with you more about this. But first, as we talk about community health during a pandemic, I'd like to introduce to you Dr. Catherine Bodnar, the medical director for the Midland County Health Department, to talk about this. So welcome, Dr. Bodnar.
Thank you, Sharon, and good morning to all. Well, needless to say, 2020 has been a year like no other. We're in a devastating global pandemic that's affecting all of us, with some feeling the adverse effects much more than others. Then in May, we had a 500...
Good morning, it's for Gransden, Bridget, so black coat.
Then in May, we had a 500-year flood, dam failure, and catastrophic flooding in the midst of the pandemic. Through these extremely challenging times, the Midland community has remained resilient and has provided amazing support to those in need. There are so many examples of neighbors helping neighbors, outreach from many nonprofits, businesses, and government organizations. In December 2020, we began to see some light at the end of the tunnel as the first doses of the COVID-19 vaccine became available. We need to have about 80% of our vaccine eligible population vaccinated to quell the pandemic. Until then, it's extremely important to continue public health measures, even if you've been vaccinated. These measures include social distancing, wearing a mask when indoors in public, and outdoors when you're not able to socially distance, social distancing, avoiding gatherings outside your immediate household as much as possible, and frequent hand washing or sanitizing. Through this backdrop of the pandemic and flood, dam failure, and catastrophic flooding, the Midland Health and Human Services Council has continued its remarkable work on the Community Health Improvement Plan, or CHIP, designed to improve health and well-being for all of us. CHIP leadership are here today to share some of the extraordinary progress that's been made in 2020. Thank you.
Thank you, Dr. Bodnar. And now next up, we will have updates from each of the areas, and we'll be starting with healthy weight. So we have Tara Robertson, who will begin our healthy weight update. Tara?
Thank you very much. Good morning, everyone. My name is Tara Roberson, and I'm a community nutrition instructor with Michigan State University Extension. I'm here this morning representing the Healthy Weight team, and I'm very excited to share with you our successes over the past 5 years, our accomplishments from last year, 2020, and our goals this year moving forward in 2021. So the overall purpose of our Healthy Weight team, which is a group of different organizations in the county, is to improve the overall wellness of individuals in the community here in Midland through physical activity, nutrition, and food accessibility. So since we first came together, we've implemented a variety of programs and actions in order to reach these goals. And you can see here on the slide a list of our different projects over the past 5 years, but just to highlight a few key ones, they're all really key and very important. But when we first started, we developed an asset map for Midland County for Healthy Weight team activities to track them, and worked with the Midland Public School graphic design class to come up with a tagline. We had a variety of programs, including Plot to Plate, wellness advocacy programs, and senior activities. And in 2019, we started our first pilot prescription for health program, which we have since expanded on because it was very successful. All right, next slide, please. All right, so kind of as mentioned earlier, this past year, we did see a lot of new challenges and barriers due to the pandemic. And I'm very thankful to be able to say that despite this, we were able to adapt and overcome these challenges and barriers. Our focus this last year in 2020 was to provide eating and exercise programming at local schools, increase access to fresh fruits and vegetables, and provide nutrition education, and expand on our pilot prescription for health program that started in 2019. Through our efforts, we did see success in all 3 of these areas, which we're very excited about. For the school programming, we did provide Louis Loon exercise poster sets to elementary age school children, and that was done at the schools listed on the slide. And Louis Loon even made an appearance at one of these schools, which was very fun. Our prescription for health program, we did see an outcome, very positive behavior changes through this program, which is really, really great to see, particularly an increased consumption of fruits and vegetables in participants. And if you're interested in learning a little bit more about this program and seeing some more of those outcomes from last year's participants in the group, we are going to post those on the Midland County Health and Human Services Council Facebook page. So feel free to check that out if you're just interested in learning more. And our team also developed and distributed over 2,000 healthy recipes to patrons at food distribution sites. And these recipes included foods that were in surplus in the fall. So this included chickpeas, black beans, and kale, foods that maybe people don't always necessarily know what to do or have an overabundance of. So it was really great that we were able to share some recipes to the community so that they could learn how to stretch these foods and how to use them. All right, next slide, please. All right, so our focus areas for this year moving forward, we really want to continue to build on our efforts and goals and achievements from this past year in 2020. So that again includes, providing healthy eating and exercising programming for the school-age children, increasing access to fresh fruits and vegetables, and expanding again on that prescription for health program. Some specific examples of our plans moving forward include for prescription for health, we are adding an American Sign Language instructed class that will be for the deaf community, and it will be instructed by a deaf instructor from MSU Extension. So we're very excited to be able to kind of expand on that class and make it more accessible to more people. We are also looking into creating a food pharmacy with the help of Hunger Connections, and into adding a potential food navigator on site at the Midland Area Farmers Market. And this will be somebody who will be able to be at the market to assist shoppers in learning about and using food assistance benefits that are available to them, and navigating the farmers market if they're a little more unfamiliar with that. And those are just a very brief update about our accomplishments and what we are working on. So thank you again, everyone, for your time today. And we do look forward to continuing to provide the community and all of you with resources and programs revolving around that physical activity, nutrition, and food accessibility. Thank you.
Okay, next slide, we'll move to later life quality. Charlie.
Well, good morning, everyone. Later life quality. I'm Charlie Schwedler, the Executive Director, Senior Services, and somehow I'm growing into this area. But as I like to say, and most of you know, I'm growing older, but not up. Anyhow, our 5-year accomplishments have really been quite impressive. So fall prevention and advanced care planning, these programs really have been going on right since the beginning and truly have become institutionalized. So we still work with the fire department and police and the hospital in terms of helping folks make sure their homes are fall free, so to speak. And we also work with the hospital in terms of advanced care planning. Everyone should have an advanced care plan. That shouldn't be a surprise to the folks around you. So hopefully you're working on that as well. We've also had an incredible collaboration of community partners with MCVAN. And again, this is the Midland County Vulnerable Adult Network, which includes several folks from the community, including law enforcement and the prosecutor's office, as well as nonprofits that work for and with vulnerable adults. And we've really had a lot of accomplishments in that, and we'll talk some more about that later. We've focused on loneliness with older adults. This is a big deal during regular times, let alone the times that we're dealing with now. And we've created a great partnership with Mid-Michigan Health and 211 in regard to what we call the Bridge to Belonging partnership. And this focuses on loneliness and isolation and getting folks connected. And maybe above all, we've had an incredible collaboration and partnership with community-based nonprofit and private organizations that work with older adults. I can't tell you how many things we've accomplished by talking with each other, understanding each other's issues, and working to accomplish the goal of working with older adults to make their quality much, much better in their later life. Next slide, please. So this past year, we have really done quite a bit, as you know, especially when you take into account what has happened. There was definitely an increase in isolation and loneliness, so we had to reach out a lot more to folks, both due to the flood and dam failure, as well as obviously the pandemic. So we have worked really hard at that. We've gotten innovative about that. Some of the things we've done will help us even as we get out of this. I mentioned the Bridge to Belonging implementation, or the Bridge to Belonging grant. We've really worked at implementing that, and we have seen results. We have seen people get connected that we believe would not normally have been connected to different programs, senior services being one of them. And so we've been really happy with that. Working to support vulnerable adults, especially financial abuse and those kinds of things of vulnerable adults, has been extremely difficult during this time because of the inability to visit with folks and as other people have found. But we've still been able to do that. We found unique ways to do that. We've worked much more with different groups in terms of food insecurity. Hidden Harvest, I'm guessing Sam's on the line. We've done several things with them. All of our partners have. And so we work really hard. We're still feeding folks. We do curbside here. We do Meals on Wheels. We work with Hidden Harvest. We work with North Midland Family Center, West Midland Family Center, everyone else, to make sure that food insecurity isn't adding to the problems that we have right now. And then we've also been working on discussions with health care providers regarding the discharge of older adults. You know, once they finish a hospital stay or a rehab stay, that's a big issue for us, and we're still continue to work on that. If I could have another slide, please. So this year, what are we going to do? We know we have to work with our outreach to isolated older adults and loneliness. So that won't, I don't know that that will ever go away, but especially during this time. We are really working on a system to assist the discharge and care of older adults. That is a big issue for older adults, and we will continue to do that. The collaboration with MCVAN will continue. It has to, because unfortunately, the abuse and the issues that go with vulnerable adults is not going away and is exacerbated. We're going to continue the partnership with Bridge to Belonging and 211 Mid-Michigan Health, and we will make sure that that grows exponentially and we get folks the help they need. And then again, I can't emphasize enough the great partnerships we have, both public and private, with folks that work with older adults. We're pretty excited about what we're doing. We're going to continue to do it. We're going to get better at doing it. And we appreciate all the support we get from the community. Thank you.
If we can go to the next slide, please. I'm Sam Price. I'm the CEO for 1016 Recovery Network and a co-chair in the area of substance use disorder, along with my co-chair, Catherine Tate from the Legacy Center, who you'll hear from in a moment. And really, when we kind of look back at our 5-year journey, you know, things really kind of sprung up in 2016 when really the opioid epidemic was really starting to just gain some negative momentum, which led to a lot of positive momentum. And one of the things that really kind of we look back on as one of our primary accomplishments is working with our statewide funder to be able to establish a position for a community integration leader. Because what we saw was, because this is such a multi-layered problem and concern within the community, that there was a lot of wonderful effort coming up through the grassroots and through different, you know, through law enforcement, through the medical community, the treatment system and whatnot, that we needed to figure out how we could kind of herd the cats and get them all kind of moving in the same direction. And so with this creation of this position, was really be able to start working with different community groups and get us moving into a way that allowed us to really have parallel community-wide collaborative responses to the opioid epidemic. So we weren't kind of tripping over each other, but we were kind of channeling that energy towards the accomplishment of really doing some really cool things, which includes, you know, looking at the prescribing practices of our medical community and working with Mid-Michigan Health to look at how some of those things are working, getting an increased awareness within the community and getting Narcan, that reversing miracle saving drug, in the hands of people that have concerns and needs, knowing how to use it, being able to increase our options for treatment and recovery support services in a variety of different ways, have all come forward through For a Brighter Tomorrow and for Families Against Narcotics, Peer 360, 1016, Family and Children's Services, just a lot of different activity. The Midland Recovery Center have all kind of just grown leaps and bounds in the last 5 years. We've really, then on the prevention side of things, really expanded our community impact in our school programming to really elevate the awareness of opioids, recreational marijuana risks, and other things along that lines, vaping, e-cigarettes and whatnot. So we're really pleased with that. So I'm going to hand it over to Catherine to kind of take the ball from here.
Thanks, Sam. All right, so looking at 2020 and 2021, I mean, none of us expected what happened. So We did the best that we could, and honestly, our successes from 2020 were that we adapted our services, that we continued offering substance use prevention, treatment, and recovery throughout the pandemic. We were able to adapt our services. For example, prevention turned to digital media. We used our partners through the community to distribute Narcan instead of having Narcan trainings, those that were already interacting with people on a day-to-day basis. Our treatment and recovery services were able to continue, but it looked different. We still had inpatient services through a number of agency partners. Many of them offered PPO to clients so that they could come into the office for counseling. We had virtual counseling pop up all over the community. Our recovery housing, and recovery groups were able to continue serving clients as well. So we're really pleased that we just were able to continue services in 2020. For 2021, in all honesty, we're just hoping that we'll be able to continue services, expand a little bit from where we are, and just be nimble and adapt to the changing needs and opportunities that arise. We don't know what this year is going to bring, so we continue to chip away at it a little bit at a time. And I wanted to share with everyone, if you could go to the next slide, Kevin. In substance use disorder, we don't often hear about the impact of the work that we do. It's pretty quiet and it goes unnoticed, but we had an email recently that was worth sharing with everyone. So the email said, "The work that you do is so important. Thank you for the Narcan training and for the free Narcan. You assured me that it was okay, and I took 3 from the last presentation you gave that I was able to attend. One for my workplace, as the community members we support often have needs beyond our services. One for my home, and one that I gave to my in-laws that they used to revive my brother-in-law from an overdose. Thank you for saving his life." Thank you. And I'm going to turn that back over to mental health.
Hi, I'm Kathy Dollard, and I work at Mid-Michigan Health as the Director for Behavioral Health. And when we look back, we're really pleased that our collaboration has led to positive outcomes. The HOPE portal has made the task of finding behavioral health care much easier. Through training in evidence-based suicide assessment and treatment, through hiring a social worker for our emergency department, and changes to policy and procedures, along with collaboration that fills in gaps, our community is better able to deal with the problem of suicide. We have worked with law enforcement and trained personnel in crisis intervention training using the Memphis model, which is the current gold standard. In addition, we have more therapists in our schools. We have provided training to school personnel, along with direct services to schools, including classes on mindfulness, suicide prevention training, and well-being curriculum. We have made efforts to fight stigma by sharing positive messages about mental health recovery and well-being through articles in the Midland Daily News, through podcasts, television, and radio spots, and other means. Of course, there's still much to be done, but there's also a lot to be proud of our work over the last years. Now I'm going to hand it over to Dina Mason, the Program Director for Community Mental Health for Central Michigan, to talk about what we accomplished in 2020.
Thanks, Kathy. Despite the challenges of 2020, our mental health partners worked together to create positive change. We chose 3 accomplishments to share today. First was the kickoff of Mental Health Court, which we will be highlighting today in this short video of Judge Karras talking about Mental Health Court, which I think Kevin's going to pull up in just a second.
The idea behind the Mental Health Court is to provide close coordination between the criminal justice system and the mental health services community. Our Mental Health Court is designed, to work closely with CMH as a primary service provider. We also have close ties with Partners in Change, so we're fortunate in that respect also to be able to work together with our probation department to monitor probationers' behavior. So the whole thing is designed around the population that they have serious mental illness, and that mental illness is really the primary driver of their criminal behaviors. Now, in most every case, there are also co-occurring issues. So substance abuse is common, but the idea is if we primarily address the mental health issues, that will give us the most bang for the buck, so to speak, in terms of modifying their behavior, getting them on track, and establishing them with new, healthier habits going forward. The whole idea of mental health court, or one of the ideas of mental health court, is to be proactive. So we're all working together, which we're not able to do in a normal situation. Midland County is a place where we want everyone to thrive. And so we have to build a solid foundation to do that. So that means we need to be addressing the needs of everybody. There are a lot of people that have issues. They have substance abuse issues, and they may have mental issues, and those may lead them to criminal acts. So they have now convictions. They live with us. They are in our community. They are part of our community. So the benefits are, for all of us, is, when we walk down the street, you want to know that you can be confident that, yeah, people who might, have problems, that they're being dealt with in a way that is as effective as possible. That we take the time, that we invest our time and we invest our talent, and sometimes we invest our treasure too in the form of grants and whatnot, to work the best we can for these people, not just for their sake, but for everybody's sake, because it makes all of us safer, it makes all of us better. It makes our community better.
Second, a free mental health and wellness mobile app called My Strength was made available to the community. And on the screen here in a moment, you'll have the website information, but you can, I guess it's not the website information. It's www.mystrength.com. And if you visit My Strength online or through your mobile device, you can find it on your app store in your mobile device. You can use the code CMHCMCares to use that app for free. At the end of today's presentation, if you're interested in learning more about My Strength, please stick around. We're going to share a 90-second video that explains in a little bit more detail some of the benefits of the My Strength app. And last but not least, our mental health partners spent a lot of time in 2020 exploring sustainable funding sources to address some mental health gaps in our community, specifically to accessing mental health treatment. And as a result of this, we implemented a number of new partnerships, including second youth intervention specialists placed in the schools, several counselors in the schools, social workers in our physicians' offices, and even a social worker at the jail. So we ended up accomplishing a lot for such a rough year. And Kathy's gonna follow up on what our plans are for this year.
Okay, on the next slide. We have some bold plans for the coming year. First, a committee of community partners is working to enhance our response to people who are in a mental health crisis. By working collaboratively, we hope to develop a better approach than what we have in our current system. After this difficult year, we are also working in schools to enhance well-being for students and staff. We continue the program that we have launched this year called Peer-to-Peer to increase awareness and response to students who are struggling with mental health and hoping to prevent the tragedy of suicide. We look forward to working as a community to tackle these issues as we are stronger together. Thank you,
Kathy and Dina. And then on the next slide here, as we wrap up, I wanted to thank all of our presenters today, all of those that are on their committees, and our Health and Human Service Council members for their commitment to make sure that we continue to address issues even in the face of a pandemic, and that we help to move our community forward in addressing just key areas. Thank you all for attending today and for hearing about the important work underway. We welcome you to reach out to any of our presenters today if you'd like to get engaged with their committees that are addressing these different areas in our community. We also encourage you to like our Facebook page. We are reactivating our Facebook page and we'll have some resources there. So we encourage you to please go ahead and like our Facebook page. We will at this moment take question and answers, which you can do through the chat, or if you would like to unmute and ask a question of any of our presenters, we will take your questions. Then we'll conclude this part after we've handled your questions, and we will, for those that would like to stay and watch, we will show that My Strength app video at the very end. So questions. Okay. If you would like to type one in the chat, you're welcome to do that. And if there are no further questions, I think on our next page here, we just had the questions page as we wrap up. So if there are no further questions, then we will thank you all for coming and conclude this part. And then we will show the My Strength app. Okay. Okay, thank you all. All right, we are working to we're having a slight issue here with technology, which it's worked beautifully for this whole thing. But right now we're trying to access the My Strength app video so that we can show that to you. So it may be just a delay of a couple moments here as we address that.
Hi, Sharon. I have a question. This is Tara again.
Sure.
I just saw in the chat that somebody had mentioned they would love to get everyone's email address and title so that they can share that. Would you like for us, the presenters, to type that into the chat box, or will you be sending that out in any format?
If you'd like to type it in the chat box now, we can certainly do that. And then we could also, if you would like to put, we could also take those email addresses and post them on our Facebook page as well, so that they'll have access as well through the Facebook page. But if you could type it in now, that would be great. Thank you. Other questions? Great. Okay. Well, thank you all. And then we're going to see if we can readmit Kevin as our co-host who handled all the technology. Apparently Zoom kicked him out.
You know what, Sharon, I could send the link for the video to be posted to Facebook as well, if that will work.
Okay, why don't we do that since we're having some issues? Why don't we go ahead and we'll put that link for the My Strength app. And I will mention it's a wonderful tool, as Dina's already highlighted, that can be helpful to people. With wellness in general and well-being. Great. Okay. Well, thank you all. Thanks for attending today.